Thank you very much. My Rotary story, sometimes people tell me your Rotary story, and I don't know where to begin. You know, when your story spans 4 decades, you know, where do you start from? Well, let me say this, that I started my Rotary journey as a Rotaractor. I was the charter president of the Rotary Club of then Federal University of Technology, Bauchi. I think it's now called Abubakar Tafawa Balewa University. So I was the charter president of that Rotaractor Club, and I think that was 1985. Sometimes when I mention this case, it makes me feel so old, but it's okay. So that was in 1985, and then when I left university, I went to Port Harcourt. I was posted to Port Harcourt for youth service, and at the orientation camp, I led an effort to bring together all the Rotaractors that were in camp. And I'm mentioning this deliberately because that's an opportunity we are missing from an institutional structural point of view to get people into our Rotary movement. And then I became a member of the Rotary Club of Amadi. I was president of that club sometime in 1990, 91, I think one of those dates. And then in 1993, I joined the Rotary Club of Amadi. And I've been a member of that Rotary Club till date. So you can see my Rotary story, that's about 4 decades that we're talking about.
So when you say 4 decades, people would think you're very old, but actually RIP is a very young man. You can see it in the video and all. So now we mentioned something about polio because
and I think you said something about the Save Blood
yes.
project. Let me say a little bit about that, because it is one of those things that talks about the essence of Rotary. You know, the power of Rotary and the power of service, the power of our connections. The Save Blood Africa project started when we received a group study exchange team from California. That group study exchange was led by a friend of mine, a very good friend of mine, is now late. His name is Warren Kaufman, from Camel Valley in California. As part of their exchange, he was in construction. But one of his exchange team members, because he was the team leader as a Rotarian, one of his exchange team members was somebody in the health sector. So on that particular day, there was a conflict. You know, should we go to a medical facility or should we look for a construction facility? So they decided to go to a medical facility. And Warren was there, and typical of what happens in our environment, a woman was in labor and they needed blood. In his own part of the world, blood is needed, you open the refrigerator, you bring out the blood, and there's no problem. But I saw people running around. I said, what is the problem? He said, they need blood. And then he offered to donate to that is B positive or something like that, the blood type that he needed. And he tested him, it was okay. And the husband of the poor lady was worried. If you transfuse Oyibo blood into my wife, what will happen? Will she start to change color? Will you know those kind of things? So after that experience, Warren decided that we should start a project that will provide non-paid or altruistically donated blood to make it available in Nigeria in the first instance and across Africa in general. And as a result of that project, we provided blood banks in several hospitals in Nigeria, and I think in your district we provided in Shagamu, General Hospital Shagamu. We've also provided about 4 or 5 blood mobiles. You know, the Americans call it blood mobiles, but those are mobile blood centers. It almost looked like the size of a luxury bus, you know, with everything inside to collect blood. I can't remember whether we sent one to Shagamu also. But I know we have one in Ibadan, we have one in Oyo, one in Port Harcourt, one in Jos, one in Eke, something like that, you know. And thankfully, of the 5 or 6, 4 of them I'm aware are still working till date. So that is the story of the Save Blood for Africa.
Well, it's interesting. This service above self. So as we rightly said, you're a vanguard for end polio. So Rotary's commitment to eradicating polio has remained one of its most impactful humanitarian pursuits. Having served actively on both the End Polio Now and Polio Plus committees, what key lessons or experiences have you drawn from this global campaign?
Thank you. The first thing is, let me state it again, polio remains our number one external priority. I've had Rotarians ask me many times, after polio, what next? After polio, what next? And the answer is simple. We don't know what next because we don't want any distraction. We are focused on polio. Until we are done with polio, we are holding no conversation about what next. And we don't know, maybe after we've done with polio, are we going to have another corporate project the way we've done with polio? Or will it be a regional kind of project? I don't know, and we don't know, but we are not talking about it. We need to finish polio because we are not done with polio yet. When we are done with polio, we can talk about other things. What lessons have we learned? Is the power of partnerships. The power of partnerships. I don't know, we have many new Rotarians coming, so allow me to tell the story a little bit. You see, about 1985, when this project started, we had something we call the 3H grants. It's a 3H. The H was health, hunger, humanity. So we call it 3H grants. Like to call global grants, program of scale now. It was called 3H. And we decided to immunize children. I think it was in the Philippines. And then we immunized all the children below the age of 5 in the Philippines. And polio disappeared. Polio disappeared. I said, wait a minute. If this is all it takes to get rid of it, why don't we do it around the world? Of course, we knew, even though we had the spread, we had the footprint, we couldn't do this alone. So we approached the people who should know how to do it. WHO, UNICEF, And let me say this, when we approached them, it was like, you want to eradicate a disease? We say yes. Are you aware that only one disease has ever been eradicated on this planet? And that was smallpox. We said yes, we want this to be the second one. We said, are you guys medical people? We said no. Are you epidemiologists? We said no. So who are you people? We said we are business and professional community leaders, who make sure our world is better. And he looked at us and said, you guys are not serious. Anyway, if you are serious, go and bring $120 million. If you raise $120 million, we'll get it started and we'll get it done. I know what my fellow Rotarians did. We raised $240 million to let them know that we're serious. And then we started. And as of today, when we started, there were 125 countries on this planet that were polio endemic. And polio was maiming or killing 1,000 children per day. Per day. Today, we have only 2 countries left that are polio endemic, Afghanistan and Pakistan. And even within those 2 countries, it is confined to a narrow area of those countries. And as at the last report that I saw, the number of cases we've recorded this year is the lowest we have ever recorded. So which means we are almost there, but we are not done yet. We need to finish that job. But the legacy of the Polio Eradication Initiative is what I think we were seeking. The power of partnership. Look at what we call the Global Polio Eradication Initiative, GPEI partners. World Health Organization, UNICEF, Bill and Melinda Gates Foundation, the Gavi Alliance, that's the Gavi Vaccine Alliance, and others. Without them, this can't happen. But you see, within the alliance, we had assigned roles. And in that alliance, though we are the leaders of the alliance, it was our initiative. We have our own roles to advocate, to create awareness, and to fundraise. UNICEF has their own role, because when it comes to mobilization, things to do with children, they have the experience. The same with WHO, they are the health experts. So when we've run into trouble in the past, they are the ones who have come with solutions. Let us change from this vaccine to this vaccine. Let us stop using this and use this. That has gotten us how far we have come to. And on a structural level, and I hope Rotarians listen to this. For us as Rotarians, and for me, who is from Nigeria, who is from a country that was recently certified polio free, who has interacted directly with this process. There are some parts of the world that have not seen polio in 50 years. To them, it's just history, it's stories. It's trying to connect to their heart. I saw it. I saw the last child that was crippled by polio, by white polio in Nigeria. We have developed some kind of trust with our communities, with our governments. Some of the people we have trained to do the immunization work are now being used to sort out other diseases. For example, when Ebola broke, it was our contact tracing process that we used for polio that was used. And so we kept it we nipped it in the bud very, very quickly. During COVID, it was the same thing that was deployed. Because we have people, the way polio eradication works, you start from the ward level. And every Nigerian belongs to a ward. From the ward level, like that, local government, and the rest to the state and to the federal government. That was what was deployed during COVID. It was we call it the polio infrastructure. That's what was deployed. And the same partnership, WHO, UNICEF, and co, worked with us to make all of that happen. And let me say this, as a Nigerian, I recall there were resistance to COVID vaccines in some places. But when they saw us as Rotarians, I remember I was in a community and they asked us, Rotary, and I believe we could take this one too. They were seeking our consent. We don't trust this thing, but are you saying we can take this also? Because they know us, they've seen what we've done with them, and we say yes. And we showed evidence that we ourselves have taken those vaccines. So that is the legacy. And if you allow me to just dream, I've asked the question, I've thought about it in my mind when I go for polio eradication. Imagine we use the polio network to distribute seeds for agriculture. We can use those things to get seedlings into the hands of every family to plant something. That's agriculture, not even health. I just use the same network. I get excited when you ask me about polio, so forgive me.
It's interesting. And you keep mentioning Nigeria. Don't forget, Nigeria is his first constituency. So anybody listening, just have to know this. So this shows how tenacious and intentional Rotary is. As we know, Rotarians are quick of action and they're always ready and willing to help. So now let's talk about your presidency, which is very soon. So as the incoming president of Rotary International and also as a Nigerian, I must mention that as a Nigerian, yes. So what innovative ideas or strategies are you bringing to further strengthen Rotary's impact and relevance around the world?
Again, that's a question people have asked me many times. We have a vision statement for Rotary. And I expect by now, every Rotarian should know it off heart, even if it's not in the way it is written. And that vision statement says, together, we see a world where people unite and take action to create lasting change across the globe, in our communities, and in ourselves. That's our vision statement. That vision statement has a set of strategic priorities attached to it. Because if you have a vision and you don't have activities, actions to take to realize, you are just dreaming. It's a dream, not a vision anymore. And we have 4 strategic priorities, to increase our impact, to expand our reach, increase participants' engagement, and increase our ability to adapt. Each of those strategic priorities have activities, actions under them every year. We are on the 5-year stretch of the current one. Every president delivers on those action plan priorities. That is the thing we have done to stabilize our organization. So people are not just picking things and picking things and picking things. We can structure it and say, yes, pick whatever you want to pick, but make sure it addresses some of this. And so as a president, come 2026, 2027, we'll look at that same action plan priorities and ask ourselves, which of these are we working a little bit more on, depending on the results we've achieved by the current presidency, and my successors will do the same. Let me use this opportunity to send a message to our Rotary Club leaders. Club presidents are excited doing many things, and I see them do some things, small things here and there. It's okay, but I do tell them, if you're a president-elect, let me address them, if you're listening to me, even a president who is very, very smart, I ask you, take 4 sheets of paper, put a heading, increase our impact on one, participants' engagement on another, ability to adapt on the third, expand our reach on the fourth, and then look at all those fancy things you've said you are going to do, and try to put them into each of those boxes. If there is anything you have planned to do, and you struggle to find which of the boxes to put it in, throw it into the dustbin. It is a waste of your time, it is a waste of your money, it's a waste of your membership's time also. Because it's not going to help us to move the dots. It will not move your club forward. It may be exciting. And then think about it. What are the things we can do that will move all of those things? I've noticed that a lot of times, ability to adapt is the one that is usually very scanty, that has nothing. But in conversations and strategic retreats of clubs that I've attended, I've tried to force the leadership, think of something. What is that thing, what is that innovation that you think you can implement in your club over the next 3-4 years? That's your ability to adapt. If Rotary must remain here in another 100 years, we cannot use the tools of 100 years ago. And that's our ability to adapt.
And this, we are draw the content of today's program.
Thank you very much.
So we want to Global Radio extend our profound gratitude to Rotary International President-Elect Olayinka Hakeem Babalola for gracing us with his wisdom, his vision, his unwavering passion for humanity. Your words today have not only enlightened us, they have rekindled the spirit of service that lies at the heart of Rotary. Thank you, sir, for inspiring our listeners, for reminding us of the power of selfless leadership, and for embodying the essence of service above self. Thank you very much, sir.
Thank you. Thank you very much. God bless you.
Thank you, sir.